Hey everybody, so this is Dr. Seth Evans. Today's video is by special request from someone who had commented on another of my videos on YouTube. And this person was asking for me to make a video about how I perform the turbinate reduction procedure. So we'll talk a little bit about that in this video, how I do it and why I choose to do this on patients. So the turbinates are structures that are in the inside of your nose. And you actually have 3 sets of turbinates on each side. The turbinates we're specifically talking about are called the inferior turbinates. So they're the ones on the bottom, and they start in the front of your nose and they extend all the way to the back of your nose. The purpose of the turbinates is to humidify the air that you breathe in. So when you breathe cold, dry air out in the world, as it passes through your nose, these structures kind of add humidity and warmth to the air. So by the time it makes it down to your lungs, it's warm, humid air instead of cold, dry air. So that's what we think the purpose of the turbinates is. The problem is that sometimes the turbinates become very swollen due to allergy or for other reasons, and they take up too much room in the nose. And this causes people to be congested and have trouble breathing through their nose. So in certain instances, usually where we see that people have large inferior turbinates, and patients have tried medical management like nasal steroid sprays such as Flonase, antihistamines like Claritin or Zyrtec. They've tried these medications for a month or more and they're just not getting better. They're still congested. Their turbinates are still swollen. Those are people where a procedure to try and shrink the turbinates makes sense. And the point of that would be to make the turbinates smaller so that people can breathe better. So that's usually why I'm recommending that people have turbinate reduction. I would say in my practice, in my experience, most of the time I'm performing turbinate reduction, I'm doing it in conjunction with another procedure. Frequently balloon sinuplasty, but also procedures like septoplasty or traditional sinus surgery or removal of nasal polyps. The reason is that in these other conditions, the turbinates also tend to be enlarged. And usually one of the main symptoms of all these conditions is nasal congestion and blockage. And at least the way I do it, shrinking and reducing turbinates is a very simple thing for me to do that takes a matter of 1 to 2 minutes or less. So, also in adults, I'm usually doing turbinate reduction in the office. So it's not, something where people have to go to the hospital, have to get put to sleep under anesthesia most of the time. In pediatric patients or in adults who are getting more extensive sinus surgery, that may be done under anesthesia. But the majority of my turbinate procedures are done in the office, either with a balloon sinuplasty procedure or just on their own. So how do I do this procedure? So the first thing we have to do is get the nose anesthetized and numbed. So if I'm doing just a pure turbinate reduction with no other procedures, most of the time the patient spends in my office is actually spent getting their nose numbed up rather than actually doing the procedure. So I do the same local anesthesia that I do for a balloon sinuplasty or any other nasal procedure. We start out with putting sprays in the nose. Then I use a concentrated lidocaine gel that we squirt into the nose. And then finally, I'll do some injections of lidocaine where necessary. So that whole process typically takes about 20 minutes. At that point, we'll do the turbinate procedure. So I actually have the device I use right here. It's what's called a Dennis bipolar probe. And this is something that we sterilize and can reuse again for multiple patients. So if you kind of see it here, so when I'm actually using this, there's a cord that's attached to this end and goes to a power source that provides electric power. So the other end here, I'm going to try and hold this up to the camera better so you can see. So it's basically 2 needle prongs that come out of it. And what happens is we deliver an electric energy to that end of it, and that energy mainly just goes between these 2 needle prongs. So it's targeted to a specific area, and we don't get a lot of energy spreading out away from this area. So, you may be asking why these needle prongs are so long. And the reason is the turbinate is actually at least this long going from the front to the back of the nose. So this is inserted into the front of the turbinate, and then I try and thread it into that soft tissue portion of the turbinate underneath the lining. And then once it's in the right place, I'll step on a pedal on the ground and it'll deliver the energy through there. And as I'm doing that, I kind of slowly back it up out of the turbinate. So it's going to be basically cooking the interior of the turbinate. And as that heals over the next couple of weeks, it scars and shrinks, and the turbinate shrinks down. So normally I'll place this into maybe 2, 3, maybe 4 different spots in the turbinate to try and get a good treatment of the entire structure, and then repeat on the other side. So that actual procedure part of it probably takes really only a minute or two. It's very quick. After that, if this is done in the office, patients can usually just go right home. If they've had a balloon sinuplasty, they may be a little bit sleepy from some of the medicine we gave them, so somebody would need to drive them home. But either way, it's the typical recovery. There's usually not a lot of pain afterwards. The typical thing that we do see is that crusting and basically large boogers form on the turbinates for usually about 4 to 6 weeks after this procedure. So patients do need to come back a couple of times for me to examine their nose and clean crusting if necessary. After all that, in my experience, I'd say 80 to 90% of patients get improvement in their breathing. They're breathing better through their nose. Most people are quite happy about having this procedure, and they do better afterwards. And that's why I offer it. I got into this job to help people, and I do believe that this procedure, in the method that I use it, helps people, and I plan to continue doing it. So again, we said 80 to 90% of patients get good improvement. What about the remaining 10 to 20%? In my experience, those patients either get minimal improvement or no improvement. In my experience, I've not had anyone who's gotten substantially worse after having this procedure done in this way. But there are risks, and anything can happen. So I guess I'll leave it at that. That's how I do turbinate reduction, and I hope this was helpful for everyone. Have a nice day.